My name is Faith Chepkemoi, and this is my IV push and IV secondary validation video. My patient is Lawlin Sanderson. Date of birth is January 17XX. She has sulfur allergies and she's on full code and a high fall risk. Lawlin Sanderson is admitted to the orthopedic unit following a fractured tibia due to a fall on the ice. Her past medical history is appendectomy as a child. Her social family history: she lives with a partner in a two-story building. She works as an accountant. Her weight is 152 pounds. Height is 5 feet 8 inches. On her assessment, her vital signs: heart rate is 95. Blood pressure is 134/82, which is elevated. SpO2 is 98. Respiratory rate is 19, and temperature is 36.6 degrees Celsius. She's alert and oriented, rested in bed. She has no chest pain. S1 and S2 hard for the cardiovascular exam. Respiratory exams, breath sounds are clear and there is unlabored breathing. GI, normal vowel sounds were hard. GU, she voided 300 ml per hour clear urine with assistance to bathroom. Extremities are pink and warm. There's limited movement in the left lower extremity. Her skin is pink, warm, and dry. Neurologic, she's alert and oriented to place and time. Pupils are equal, round, and reactive to light and accommodation. There are no neurological deficit. IV, peripheral IV is in place. Labs, potassium lab of 3.3 millimoles per liter, which is low, slightly low. She's a high fall risk. Her pain is 9 out of 10, and it is sharp and stabbing. The provider prescribed acetaminophen 500 milligrams PO, 6 hourly for pain, 1 to 6 out of 10 PRN, and was last given 1 hour ago. Morphine, she's also prescribed morphine 2 milligrams, 1 milliliter IV push, 4 hourly for 7 to 10 out of 10 pain every 4 hours. Which is PRN and has not received. Potassium chloride, she's also prescribed 10 ml equivalents of potassium chloride in 100 ml of normal saline 0.9 IV to infuse over 2 hours, which was last administered 2 hours ago, and the next dose is due. She's also on normal saline infusion at 10 milliliters per hour to keep the IV line open. It's continuous and it's currently running. She's also on regular diets, up with assistance, vital signs every 4 hours. We should notify provider of any acute changes. Labs should be done every morning. So for right now, the medications due are morphine and the potassium chloride. So first I'm going to take out my medication from storage and do my first medical check. So for my first med check, I'll do my morphine. So this is morphine for Lawlin Sanderson, born January 17XX. Morphine is the dose is 2 milligrams 1 ml IV push, 4 hourly for pain. For a pain of 7 to 10 out of 10 every 4 hours. Her pain is 9 out of 10, so it's indicated for the 9 out of 10 pain. She has not been given this before, so this will be our first dose. As you can see, the packaging is intact. The expiration date is not expired, and the medication is clear, not cloudy. The color is as it should be. For the potassium chloride, we are giving 10 ml equivalents of potassium chloride in 100 ml of normal saline, IV, infused over 2 hours. So this is potassium chloride for Lawlin Sanderson, born January 17. This is 10 ml equivalents of potassium chloride in 100 ml of normal saline, IV, to infuse over 2 hours. So it means that we'll be giving it 50 ml in 1 hour, and it's due right now. I'll document after I give. So I'll do my my second medical check, and this is morphine. This is morphine for Lauren Sanderson, born January 17, XX. The dose is 2 milligrams per 1 ml IV push, and this is also IV, 2 milligrams 1 ml. Should be given 4 hourly for pain. Her pain scale is 9 out of 10. This is her first dose, and she's prescribed for as PRN, and this is her first dose. I will document after I've given it. So this is potassium chloride. This is potassium chloride for Lauren Sanderson, born January 17, XX. It is 10 milliequivalents of potassium chloride in 100 ml of normal saline. It's IV, and it should be infused over 2 hours, which means I'll give it 50 ml in 1 hour. Last administered 2 hours ago, and it's due now. So I'll go introduce myself to the patient and give the medication. Will come and get my supply. Hello.
Hi.
My name is Faith Chekemoy, and I'm going to be your nurse for today. Can you tell me your name and date of birth?
Lauren Sanderson, 117XX.
Alright, I'm gonna scan. If I had a scanner, I would scan, but this is not working. So I would scan, but right now I'll do it manually. I've confirmed this is Lauren Sanderson, date of birth January 17, XX. They're not shipping hazards, the board is locked, and the room is neat. How are you feeling today?
I'm feeling so much pain.
Oh, can you rate your pain from a scale of 0 to 10?
9 out of 10.
Can you describe your pain?
It's sharp and stabbing.
Okay, do you have any known drug allergies?
Yeah, I know of sulfur.
Oh, okay. So right now your medications are due, which is morphine and potassium chloride. You can be rest assured that these drugs don't have sulfur in them. The morphine is meant for your pain, and the potassium chloride is meant for the low sodium levels in your blood that was shown in your recent labs. So for the morphine, you can the side effects can be respiratory depression, which will manifest by shortness of breath or difficulty in breathing. Sometimes you have constipation after taking this medication. Please let us know as soon as possible if you experience these side effects. Is that okay?
Yeah, that's
For
fine.
the other medication, potassium chloride, it is meant to elevate your potassium levels in the blood. Sometimes you may feel like you're aware of your heartbeat or tingling sensation. If you feel like your heart rhythm is different, please let us know. Is that okay?
Yeah, sure.
All right. I'm gonna go grab my supplies and come and go ahead and give you your medication.
Right.
All right? Okay. So,
And then I'm going to clean up another swab.
gloves. Alrighty. Knock knock.
Yeah, come in.
All right. I'm back with your medication. I provide privacy.
Okay.
Do my third med check. This is morphine sulfate, prescribed for Lauren Sanderson. Date of birth January 17, XX. The morphine is 2 milligrams per 1 ml. It should be given IV for 4 hours. The indication is pain, and it should be given every 4 hours. This is the first dose. The prescription is PRN. All right, and the packaging is intact, not cloudy. It is as it should be. All right. For the other medication, this is potassium chloride, prescribed for Lauren Sanderson, born January 17th. Yep. And this is 10 milliequivalents of potassium chloride. Yes. In 100 ml of normal saline, infused over 2 hours.
So I would dispose
Yes.
of my...
And last administered 2 hours ago, and it's due right now.
Are you still doing okay?
All right.
So I'm just gonna...
So packaging is intact. the medication is clear, not cloudy, and I'll document after giving. All right, lovely. Checking out the IV sites, they are both safely secured to the arms. There's no obvious inflammation or infiltration or extravasation. The the one with normal saline is patent. There is continuous flow, and also this one is safely secured. It's okay. So I'm gonna give my first medication, which is morphine. All right, Lauline, I'm gonna give you your first medication, which is morphine. Do you remember what morphine was meant for?
Yeah, I think it's for pain.
Do you remember what I said the side effects would be?
Yeah, kind of constipation, respiratory distress, and all that.
Yes. All right. So first, I'm gonna clean. I'm gonna clean for like 15 seconds to make sure I'm not introducing any microbes. After cleaning, I'll pass. I'll give my I'll flush it to make sure that it is patent. It's 20 to 30 ml of normal saline. As you can see, it's patent. So I'll clean it again for 15 seconds.
That always happens via IV piggyback.
And then let it air dry. And then I'll give my IV push. I'll make sure that there are no air bubbles there. Clean. And then push it for I'll push it for 4 to 5 minutes. Sorry.
Can you state your name and date of birth with me?
All right, Lolin, tell me if you're in any pain, okay?
Right.
Do you feel any pain?
No.
Okay. I'm gonna push it for 4 to 5 minutes. All right, 4 to 5 minutes done.
I did a beach like right before I did that.
I'll clean it again.
Hiking again, and I grab my medication so that I can run my third. So,
For 15 seconds.
Roland Sanderson.
And then I'm gonna flush it again, but this time I'm going to flush it with the same duration as I pushed my IV medication.
We are giving her that potassium chloride via IV.
All right, Lolin, are you okay? Do you feel any pain?
No, I'm good.
Alrighty. Okay, I'm gonna push for 4 to 5 minutes, just like the muffin. Done. And then I'm gonna clean it again for 15 seconds.
This IV site giving you any problems?
Alrighty. Okay, Lolin, are you feeling okay?
Yeah, I'm good.
Any dizziness?
No.
Okay, I'm gonna watch you for like 10 minutes and see if there's any reaction or anything. Let me know, okay?
Right.
I'll be right here. And here's your call light, okay?
Okay.
Alright, so after 10 minutes, Princess she's okay. And then I'm gonna go ahead and give my second medication, which is potassium chloride. So this is new medications, by the way. It's just that I had used for the first time. So I wouldn't let that happen in a clinical setting. So I'm gonna keep my products sterile. Alright.
Can you rate that pain on a scale of 0 to 10?
So for this, I will plug this out and then connect it like I would connect it here. I'll pinch to the chamber and then make sure I don't waste medications. I'll drain. I'll open. Of course, I would have made sure that this is closed before connecting this to the. I'll make sure this is closed, it was closed, and then I just open it slowly to let it flow to the tip.
doesn't look like I have any bubbles in here, so this should be ready to go.
There you go.
I'm going to start
Yeah, without wasting the medication. So,
primary ID.
so good. Wasted a little bit.
Swabbing it.
So, for gravity to take course, you have to put this lower. So first I'll stop it here. And then gonna hang it here.
Pretty smoothly here.
And then I'm gonna
Comfortable, Miss Anderson?
connect this here. But first I'll have to clean it for like
And
15 seconds.
I will be back to check on you in another like 30 to 50 minutes to see how you're doing. Do you have any last minute questions for me? No. Alright.
Hi Lolly.
And I'm just going to
So this is your potassium chloride. Do you remember what I told you it was meant for?
Yeah, for my low potassium level.
Oh, okay. Do you remember the side effects I told you about?
Yeah, some tingling sensations, muscle weakness, and yeah, some heart rhythm changes.
Yeah. So in case you experience those, please let us know, okay?
Yeah, sure, no problems.
All right. So after connecting, I'll turn this on.
know that
And also open this up.
are redrawn and those levels have gone up. I did ask her about her pain, but she has rated a little lower, so that's why we find out.
There we go. It's great. Are you feeling okay?
Yeah, I'm good.
All right. So I'm gonna come back to check on you after 30 to 40 and make sure you're feeling all right. Okay.
All right.
So the medication is currently running and you're getting 50 ml in 1 hour. Okay.
Mm-hmm.
So I'll come back and check on you in case of anything, in case you experience any of the side effects. Here's your call light call. Alright.
All right.
So I'm gonna go back. I'll document. I'll of course take this off. Then do my hand hygiene and then document and then clear all my clean up and I'll go back after 2 minutes. Hi Lolly. How are you doing?
Good, it's
I
going.
can see that your medication is flowing okay.
Mm-hmm.
Everything is fine. Your IV site is still patent and there's no obvious inflammation. Are you experiencing any dizziness?
No.
Are you
Yeah.
okay?
Yeah, I'm
All right.
okay.
I'll still come back and check on you, right?
All right.
In case of anything, let us know, okay? This is your call light. And then I'm going to open a curtain.
Okay.